Did it say it's being recorded? Okay. Great. I'd now like to introduce you to our presenter for today's webinar, Cap Wilkes. Thanks for joining us, Cap, and I'll turn it over to you.
Thanks, Kiona. And hello, everybody. My name is Cap Wilkes, and I'm the Network TA Team Manager and also Director of Program Development here at Rural Health Innovations. And I want to welcome you to this webinar, The Role of Networks in a Changing Healthcare Landscape. I'll be presenting today on the findings from a conversation rural health network leaders had when asked the question, what is the role of networks in this changing healthcare landscape? And to get our heads shifted and focusing on this particular webinar topic, let's get you all thinking a little bit. I've got a couple questions for you. I'm going to pull up some pods, and these are poll questions that you all can answer. The short answer is in the top of that poll question, and as you're able to type in, and you can actually make changes. This is a little bit different than a chat box. So you type in your answer and then click the icon over on the far right of that type your answer space, and it will show up in the lower part of the poll. And the question is, what are some of the changes you are noticing in healthcare over the past couple of years? Give that a little bit of a think and add your answers to this poll, if you would, to share with each other those things that you've been observing and noticing and probably responding and reacting to, just to kind of get our heads in the game. You can be thinking about this question from a number of perspectives. Perhaps it is as a network leader, or maybe it's from the perspective of a hospital or clinic that you work within or have association with. Maybe it's from a community-based orientation or from your own personal health perspective. What are some of the changes you are noticing in healthcare over the past couple of years? There's staff shortages, there's incorporation of technology, community health workers are being used, there's an interest in integration of care, behavioral health providers are attempting to care for patients' primary care needs. There's more effort towards preventative health care and increasing mergers of systems, a focus on health equity. Let's see. There's an emphasis on improvement in transitions of care. There's funding changes, uses of telemedicine. Accountable health community models are increasing. Yes, you guys are seeing so many changes, as have we. I'm also going to pull up another poll, because it's just not noticing that there's changes, but there's actually also noticing how big a deal are these changes. How big a deal are these changes for your network members and your communities? So what's the impact? So all this is happening. How critical or significant is it to the work that your members are trying to achieve, or perhaps that you as a network are trying to achieve? So is it a really big deal? Is it somewhat impactful, these changes, or really not significant? No worries. Really big deal, somewhat impactful, or not very significant. As you continue to fill out these polls, I'm going to shift us into our presentation. Last September, RHI held a Rural Health Network Summit, bringing network leaders together in Minneapolis to explore and share their thoughts and experiences on these same questions. We wanted to talk about what networks are doing as they adjust to and adapt to these changes. And I think there's a lot of consensus around a really big deal, and yes, that's what we heard as well when we came together in a summit environment. This diverse group of people that came together, all of them willing to participate and engage in the conversation, worked really hard, and we had a good time talking about and listening to each other, talking about these issues and listening to each other. The network leaders that participated in this summit are your Network Development Grant Program peers. It really was a privilege for our network TA team to facilitate this conversation and be a part of the exploration around this important question. If those folks that participated in the 2017 Network Summit would please add their name. I have another poll. I'd like you to just add your name to this list. I'm going to move it here just a sec. Up here. Just snap that in the middle so you'll see it. Who in today's webinar participated in our September event? This will give our folks a chance on the call to see which of their peers were there. In the end, this group of diverse network leaders actually came to consensus on 6 key roles that support network members in their transition toward population health. These roles really do affirm the critical work of networks in the success of their members, and I'm pleased to be sharing with you the significant findings with both the hope and actually a charge to you that you use these findings from your peers as a catalyst for innovation and change within your networks. So really a shout out to Lorna and Kelena and Kelly and the Amherst Nelson Behavioral Health Network, Tracy, Kathy Cook, Andrea Stevenson. It was a fun summit with the energy that we had going on, and our network TA team, as I said, we really feel privileged to have been part of that and grateful to these folks for spending their time with us. All right, I'm going to switch over to our presentation now. Done my intro, and this is a quick pause. RHI is your TA provider. We really work hard in partnership with the National Rural Health Resource Center to connect rural health organizations with innovations that enhance the health of rural communities. I want to spend a few minutes describing why we decided to host a summit of rural health networks. You all already identified that there's a host of changes going on and that they really are big deals. But I also want to tell a story I heard from Don Berwick at the last IHI Forum, the Institute for Healthcare Improvement, that was held this past December in Orlando, Florida. Don Berwick was one of the speakers, and his presentation was titled, All Together or Not at All, The Snuggle for Existence. He started this presentation with a mind-boggling challenge that physicists have been working on for decades. They were working to find, literally to prove the existence of gravitational waves. This is a theory of Einstein's. Proving the existence of gravitational waves required measurements 1 part in 1/60,000th. That's the width of one atom's diameter. The skinny, so to speak, of the story is that it took 1,000 individuals, more than 90 organizations across 16 countries working collaboratively to find, measure, and therefore prove that, yes, indeed, the scientific community agrees that Einstein's idea of gravitational waves is a real thing. And they did it. This group of independent and competitive scientists succeeded in meeting this challenge of finding and proving the existence of Einstein's idea. Don Berwick told the story to highlight how critical collaboration is when working on a complicated and complex problem, and he chose the word snuggle for his title to describe the act of cooperating. Berwick is referencing a book by Martin Nowak titled Super Cooperators. A couple of key points that Nowak makes is first he compares cooperation to competition, saying to succeed in life you need to pursue the snuggle for existence instead of winning the struggle for existence. And he goes on to say that cooperation, not competition, underpins innovation. And it is with innovation that challenges are met and success is reached. We, of course, know this work of snuggling as being part of a network where we really are better together. Now, a little bit more background on why we held a summit of network leaders. In December 2009, with funding provided by FRHP, the Center and the National Cooperative of Health Networks Association, NCHN, hosted a Rural Hospital Network Summit in Minneapolis to tap the collective wisdom of experienced rural network leaders and identify rural health network activities and critical success factors. The Center published the proceedings of this meeting and applied the results in designing relevant and timely services and technical assistance for networks across the country. Well, we've been providing TA to networks since 2012, just over 5 years now. All in, we've provided TA to over 250 networks during that time. And we have spent this time with networks noticing some changes that prompted us to hold another summit. We've noticed that collaboration is taking place with more intention. We've noticed a shift in the type of partners that are engaged with networks, from hospitals and relationships with clinics and long-term care facilities, to diverse membership that includes clinically oriented organizations along with community-based organizations that represent those social determinants of health. We have also seen a shift in projects and services that networks are delivering to their members because the needs of the members have shifted as well. Projects have been focused on sharing clinically oriented solutions in the past, like EHR implementations, 24-hour pharmacy coverage, or discounted or shared clinical projects. Advocacy and influence that was focused on hospitals and clinics. But there's been a shift to projects toward coordinating care with social organizations, co-locating behavioral and mental health and oral health services with primary care. And the advocacy and influence is focused toward population health. Times are changing, and it is a complex environment with many parts, many interactions, many perspectives, and really many answers. And so we held a summit because we wanted to explore with network leaders their insights and their ideas on the role their networks are playing within our changing healthcare landscape. The summit was designed to bring together engaged and thoughtful leaders in focused discussions to better understand this changing environment, and also how networks are helping their members adjust and adapt. The summit attendees, your peers, represented 17 networks across 13 states and included 28 engaged and articulate leaders. Network organizations reflected a diverse range of characteristics in terms of network maturity, geographic location, membership size, membership composition, infrastructure, and the degree of formalization. So I'm highlighting the diversity of the participating summit networks because for those that did not attend, I want you to feel assured and confident that these results can be considered as relevant to your own network, no matter its size, location, or maturity. For today, the objective of this presentation is for you to gain insights on a changing healthcare landscape through the lens of your network leader peers, explore the role of networks and find common roles that networks are taking on during these times of change and transition. And I hope that you take away a better understanding of how network members perceive the value of networks, giving you both insight and also language to use with your members as you talk with them about network activities, projects, services, and initiatives. Lastly, there will be opportunity to consider specific actions that networks can take to help your members adapt and adjust, helping them be resilient and successful in the shift towards population health. To start off the summit, we decided that it would be a good idea for network leaders to share with each other what they were seeing and noticing about the healthcare landscape, similar to the question I asked you all at the beginning of this webinar. Facilitators posed the questions to explore the trends, ideas, and practices in the healthcare arena according to 4 sequential ranges, in order from outgoing trends to future trends, ideas, and practices. And we used a wave metaphor to guide the conversation. In a wave, there is a part of the wave that is washing up onto shore. It is the collapsing of the wave as it disappears from sight. These are the outgoing ideas and practices. They are moving into our past. And the crest of the wave, where there is so much energy, we refer to those ideas and practices as established. The part of the wave that described emerging trends, ideas, and practices is where the wave is building up and gaining energy and momentum. And finally, the incoming or horizon of a wave are those ideas and practices that are just starting to be seen or noticed. There is just a glimmer on the horizon. Through the next 4 slides, as part of this presentation that is reporting on the summit findings, I'm simply going to highlight some of the specific ideas and practices our summit participants identified. A complete list is included within the report itself, and I would encourage you to have this same conversation with your boards and network staff and use these summit results as a conversation starter. Understanding the outgoing and incoming healthcare trends, the ideas and practices that you are experiencing within your own rural communities helps you continually check in on the challenges and needs of your members. So some of the outgoing trends, ideas, and practices include dependency on fee-for-service models, traditional role of primary care physicians, independence and isolation of healthcare organizations and providers, and paper record keeping and communication. These outgoing ideas and practices may be of varying degree, but all of them are taking place across the country. The established trends, ideas, and practices, those that are squarely here and present within our work providing health care, include, for example, the AAA vision for the healthcare system, electronic health records, referrals to specialists, and networks as a success strategy for transitioning to new models of care. These ideas and practices have been around for a while now and seem to be well established within our member organizations and integrated into network activities. Emerging trends, ideas, and practices, those ideas that are gaining energy and momentum, they may be starting to drive change and are beginning to be considered when making decisions about the future. These emerging trends may include new team-based models for coordinating care and care transitions. And this includes new workforce ideas and focus on retention. Acknowledging social determinants of care, which has led to network building new relationships and stronger partnerships. New financial models based on value and quality of care. And HIT, health information technology, that addresses the digital divide, communication, and data-driven decisions. These trends may be established with some of your members, but for many, they are emerging. And the horizon ideas, those that are just starting to be noticed and talked about. There's just a glimmer on the horizon. For example, responsibility for social determinants of health and acknowledgement of the need to address mental and behavioral health. Innovative technologies to deliver services. Patient-driven healthcare with community engaged in health and wellness that looks for scalable integrated care and services that can adjust to a variety of communities. And networks of networks that link clinical and community services and have a focus on long-term wellness and health in all community members. So, with all of these changes and the landscape shifting, where some trends, ideas, and practices are fading away and others are gaining momentum, we are experiencing a disruption, not only in processes, but also in the way we think about healthcare. We are shifting toward well care and population health. Who knew this experience of disruption better than Henry Ford, who says, coming together is a beginning, staying together is progress, and working together is success. In the world of organization development, being agile and adaptive to significant change is what resilient people, organizations, and cultures do. Finding new solutions, working together includes engaging with networks, collaboratives, consortiums, cooperatives, and partnerships. All are taking place and all are being encouraged. Recall Don Berwick's story of the important collaborative work of physicists. Over 90 organizations in 16 countries being able to measure a gravitational wave that exists to the extent of 1 atom's width diameter. The point is that networks are a solution to healthcare organization success in transitioning toward value models and population health. What we explored next during the summit is how networks are responding to the changes in the healthcare environment and how they are working to support their members in successfully adapting during a period of rapid transition. Recall also the Network TA Teams motto, "We are better together." The next part of our presentation is to walk through these 6 roles of networks that the summit participants identified through our facilitated conversation. These findings are a consensus-level description that I commend to you to use to better understand your own networks, be inspired to try on a new role, and use the findings as a catalyst for new innovative initiatives and network services. So here they are, the 6 roles of networks that summit participants identified, supporting members in collaboratively adapting to a changing healthcare landscape. We have serving in a leadership capacity, facilitating continuous planning, convening and engaging stakeholders, identifying and providing meaningful education, connecting resources, collecting, analyzing, and acting on data. Through the next series of slides, I will walk through each of these roles from 3 perspectives or lenses. The first one being, describe what this role looks like by broad categories of activities that networks do as they are working within this role. So this would be a description of what does this role look like. The second perspective is sharing insights that the summit participants had on how network members perceive the value of these roles. Or in other words, how do the members benefit from these network roles? The third perspective is identifying specific ideas that networks can initiate or implement within the role that support the work of members as they transition toward population health. So the first role, serving in a leadership capacity, is critical to a network's contribution to its members' success. Serving in a leadership capacity is about being responsive to members' needs, establishing a shared vision of a broader landscape. And within this role, one of the jobs of the networks is to help their members see the broader context of healthcare. And a Summit Network leader identifies that within the changing healthcare landscape, the network acts as a catalyst for change, taking a role of that starts a chain reaction with their members to help them succeed and thrive within the new environment of healthcare. Summit participants also talked about the perceptions their members have about the network's role. This can be difficult for network leaders to walk in the shoes of their members and really understand how their members benefit from engaging with the network. Here are some examples of how Summit participants see the benefit in the role of serving in a leadership capacity. This role enables collective impact and reduces isolation of leaders, and provides direction and gives leaders confidence for decision making, and creates a peer learning environment, and provides vetted resources that are trusted. This language of perceived benefits provides network leaders with language that their members will understand. It will help influence members to engage with the work of their network and invest time and energy into the long-term viability and sustainability of the network as it helps them succeed in transitioning towards population health. We also want to consider the role from the perspective of specific network initiatives or actions. Summit participants self-selected into small groups during the summit to dig deeper into each of the 6 roles. They discussed what they were doing or thought should be done within this role. For example, serving in a leadership capacity, they identified these initiatives or actions that would support their members, or maybe could be developed into network services. Within serving in a leadership capacity, the summit participants identified providing leadership training, and particularly or specifically to the internal leaders and board members within their membership, and providing technical assistance and consulting to their members, or facilitating business models that support this transition toward value. So that was the first role, and this is the second role, facilitating continuous planning. This role is also critical to the networks as they contribute to their members' success. Facilitating continuous planning talks, these are the ways of this role in how it would be described as a role. What are the networks actually doing within this role? For example, helping their members find agreement on common goals through facilitation, or engaging members in driving the network's design, or developing adaptable and agile infrastructure for the network. This is what facilitating continuous planning looks like. And when the summit participants talked about how their members perceive value within this role, they came up with a few examples from the members' perspective, that they are helped to adapt to a changing environment, and that this role enables members to move past planning and into action, and supports the member leaders in challenging long-held healthcare paradigms. You have all been involved so far in both strategic and evaluation planning, and of course also operational planning, as you are working to implement your project initiatives. Through this important planning, you have had conversations with your members that help them also see the changes that are taking place and the benefits of working together proactively and collaboratively. And what are some of the network ideas and actions? Summit participants identified the following ideas and actions that would support their members and could be developed perhaps into network services within this role of facilitating continuous planning. Suggestions were: use reflection and learning to find underlying issues, seek to align plans from broad to detailed, and communicate and visualize plans to engage the key stakeholders, and incorporate subject matter experts for exploration and learning. The third role that was identified during the summit of networks during a changing healthcare landscape is convening and engaging stakeholders. Convening and engaging stakeholders. The summit participants talked about this role as looking like these 4 items. Networks are serving as a neutral convener and acting as a collective advocate. Networks also bring community and members together for engagement and accountability and focus on the collective impact. And what summit participants saw as members benefiting from this particular role of convening and engaging stakeholders included, for example, sharing the workload of change and amplifying the needs of their members, increasing opportunity for innovation, and simplifying connections with subject matter experts. And ideas for network initiatives and actions within this role of convening and engaging stakeholders included building trust with consistent opportunities for dialogue. This, for example, may be through roundtables. Establish neutrality of network to encourage collaboration. Providing education on benefits for participating in network projects, and making it easy for members to participate. These actions and services are ones that your network peers participating in the summit would commend to all network leaders. The fourth role, critical for networks to contribution for its members' success, is identifying and providing meaningful education. As the summit participants talked more about this role, they described what being in the role looked like, and And for identifying and providing meaningful education, they identified ensuring that the education was both relevant and effective, and the mode of providing the education incorporated both sharing knowledge and sharing data. The benefits to the members within this role included savings in affordable training, an increase in knowledge of for member employees, an increase in the ability of members to adapt to changing environment, and successfully building leadership capacity within the community. Some of the participants, working again in small groups, identified some initiatives and actions that would support their members and could be maybe developed into network services within this role of identifying and providing meaningful education. For example, creating and delivering content based on members' needs, and outreaching to community stakeholders to identify education needs and presenting relevant content at community events. This is the fifth network role, that of connecting resources. What does connecting resources role look like? It includes sharing and maximizing resources between members and fostering creative strategies as examples. And the benefits that members receive within this role include increasing opportunity for accessing resources, lowering cost for access to subject matter experts, increasing organizational capacity for driving revenue opportunities, and helping members adapt to this changing environment. Participants of the summit identified some initiatives and actions within this role of connecting resources that could be developed, such as creating partnerships with non-member agencies, using technology solutions to make connections and disseminate resources, and gain access to knowledge of members. And finally, the sixth role that is critical to network's contribution to its members' success during these changing healthcare times includes collecting, analyzing, and acting on data. As the summit participants talked more about this role, they described what it looks like to be in this role. For example, gathering member data and helping disseminate results between members, and analyzing data and measuring progress for their members. This work of understanding data and using data for making decisions comes up over and over again within conversations and implementation efforts that networks are engaged in with their members. And how do members value this role that networks play? It enables their members to participate in future funding opportunities and allows for participation in value-based payment models and provides opportunities for continuous process improvement. Here are some initiatives and actions that would support network members and could be developed into perhaps network services within this role of collecting, analyzing, and acting on data. For example, collaborating with members to determine consensus on data collection, establishing data gathering and sharing infrastructure, and analyzing and reporting benchmark data between members. So, what are some next steps for you all? There was quite a list of roles that networks play within the changing healthcare landscape. I'm hoping that you took some notes or had some intrigue or ideas as I was walking through that information. If you've downloaded the report itself, all of the data is included within that report, and you can reference that as you move forward. I have a couple of polls. Again, I would love to get your insights. You've been listening to a lot of words over the last 20 or 30 minutes, so let's do some thinking. So here's a poll. I'd love for you guys to take a few minutes to to consider what you've been hearing and perhaps reading through the report, or those of you that were participants at the summit have been thinking about or maybe working towards in the past 4 or 5 months. If you would add your name, that would be awesome, to the beginning of your answer. And then what are ideas that caught your imagination or your attention during this presentation, or perhaps while you were reading through the report? So let's share with each other some thoughts on what caught your imagination or your attention about the summit results. Was there something that you were already doing or perhaps considering? Something that you know needs to be addressed, but your members are not quite ready to engage? Or perhaps an idea for a new service or project that your network could work on that would help your members transition towards the future of population health. If you would please type in your name and then the ideas that caught your attention. Thank you, Andrea. Yes, having a collective impact really strikes a chord. I hear that term regularly. One of your all's peers out in California, Susan Jen, often works towards the effort of having collective impact as a network. Sure, finding leadership training is helpful and vital to the network, talking about how you can leverage your network and provide training to your partners. One of the tasks that networks are so good at doing is helping everybody explore what everyone needs to know together to be as strong as possible as a collaborative. Aspen adds a listening tour with members to see if we are on target. I think using the wave analogy, Aspen, would be a great opportunity for your group to talk through some of the changing landscape. Randolph, thank you. Sharing best practices, yes, so that everyone stays on the same page and learns from each other. Caslin, sure, concise summary of roles and values that longtime members can sometimes take for granted. Yes, I think articulating those roles from the perspective of the benefits that members use can give you all some fresh words to use when you are articulating the value that your network brings to your community and your partners. Cheryl, emerging new team-based models for care coordination and transitioning. It is needed work. I think we heard that over and over again at the summit, and through our TA check-in calls, we see this work of coordinating care and transitioning of care as being very important. Leandra, providing meaningful education and sharing best practices, yes. So much overlapping between your partners. Not recreating the wheel saves everyone time and energy. Data collection and analysis is easier than it sounds. Difficult to find accurate sources. Joan, thank you for that. That is so true. And I think something that takes up a lot of time and energy. But a very critical role as your members are trying to transition towards the future, so worthy of that effort. Nadine, grant project really fits in with multiple network roles. Yes, I think that everyone will find that is so true, and what I'm hoping is that if you have, for example, missed one of the roles, that you aren't working within that particular role, it might be something to consider as a new aspect or a focus area. Maybe not right away, but again, one of those things that you can keep working towards. Barry, thank you for adding in. You like the ongoing planning. Yes, absolutely. I think the continuous planning is something that was really obvious, had a lot of energy at the summit as something that is important and a very important role for networks as they bring folks together. I have one more poll for you all, and that is ideas for your next step. So part of when we learn new information, and this certainly was a lot of words, and with 6 roles, it's a lot of effort to listen and stay engaged. So I'm asking you all to think a little bit now about perhaps some very specific next steps. So if you had an insight during this presentation so far, or as we begin to consider the topic, if you would add, again, your name is very helpful so that we can keep up with what people are talking about within this peer environment. What are some ideas about next steps for using this summit report to snuggle for existence, being inspired by Don Berwick's thought and those physicists that worked across the world to answer a very difficult question. Likewise, in our complexity of the changing healthcare environment, we need to snuggle for existence as well. Lorna, thank you for that, communicating and visualizing your plan. That certainly is a critical aspect, and one of our roles as networks is to help our members understand the planning steps and keep up with each other so that nobody gets left out or falls behind as the community works so hard to improve the health and wellness of their communities. Nadine, thank you. Looking at roles that fit best with our project today and which ones perhaps into the future. So that actually fits real well, doesn't it, with the continuous planning as you keep up with the changing healthcare environment and the needs of your members. What roles can you put into play that will make a difference? Randolph adds meeting often with structure and objectives. Absolutely, if you've got those objectives, it helps with that continuous planning mode. Any folks out there thinking about adding new kinds of members, maybe broadening your collaboration effort might be a next step as we think about convening folks and stakeholders. Susan, thank you. Continual collaboration certainly is, evaluation certainly is important to know that we're making progress. And Tracy, actively working on quality dashboards and creating partnerships with non-member agencies. Yes, that's very specific to a couple of the different roles, so good insights. Christy, yes, she's expanding new network partners. And Caslin, communicating with new and old partners in the integration task force we're convening. Absolutely, Caslin, if these words from the summit can help give you some of that language. And Cheryl, sharing this information with organizations that you're working with. Yes, the horizon, emergent, established, and outgoing ideas. In fact, I really do hope that you all can use these summit findings, the beginning part where we're looking at the changing healthcare landscape, and have that conversation with your boards and with your stakeholders and partners, because of course it's the changing healthcare environment is unique for every community across our country, but the responses to the changing healthcare, disruptive as they are, really has a nice common fit where networks are making a significant difference to their members and helping them succeed. Nice job in thinking through these next steps. I have walked through the summit findings, and you all have both this webinar slide deck along with the report. So please, I hope that you continue to study it, and I really do challenge you to figure out how to bring this information and integrate it into your work as network leaders, and as you provide services and support your members as they're striving in such a difficult environment, truly a disruptive environment, where they need all the help they can get to move into the future towards population health. If there are any questions you have, I would love to hear them either in the chat box, or you can use your phone. I think *2 to unmute would be a good way to do that. I'm going to have Kiona move us into the closing part of our webinar template. This simply has some opportunity for you all to give us some feedback on this webinar in particular, but I'm going to also highlight that middle box that says suggested topics for future webinars and our peer calls. This is an opportunity after all of that new information. Perhaps there's different ways that you are thinking about your network and noticing that you might have a gap in either your own knowledge or insight, or perhaps resources that we as your TA providers could help you with by a webinar, or perhaps even a tool. So think for a minute about the suggested topics for future webinars and peer calls. We'd love to hear from you about that. I'm going to highlight that we've got our upcoming TA event, the All Programs meeting, and we are so excited about seeing you all next week. We just got a count just today that there's 99 network development folks registered. So out of the 15 programs that you all are part of, the 51 programs that you all are a part of, 99 individuals will be attending the All Program meeting. So the first 2 days, of course, are filled with topics and conversations that all the community-based division programs, network programs, will be participating in. And then on Thursday morning, on March 1st, we'll be getting together as a group, network development meeting. And so we have, as your TA provider, we do have some time that we'll be presenting and hanging out with you all. So we're looking forward to that. Any questions at all for folks, for either me or about the All Program meeting? All right, well, we're actually ending our presentation a little bit early today. I thank you very much for your time and your attention in this webinar. I hope that you enjoyed it, and also that this summit report is useful to you. We are quite pleased with the results, and again, I'm going to say how much we feel honored of working with the network leaders that participated, and thank them once again for their time and energy in those conversations that we had. So I am going to sign off. Thank you very much, and you all have a nice rest of the day. Bye-bye.
Thanks again to everyone for their participation today. We greatly appreciate it. As always, we encourage you to reach out to us at RHI with any TA questions you may have. Thanks again for all of your participation. Have a great rest of the day, and we look forward to talking to you soon.
This conference is no longer being